Good morning, everyone. As I mentioned, my name is Gina Rodriguez, and I'm the project coordinator for the Community Health Training Institute. I want to welcome you to our training this morning on engaging local officials in your work, tips, tools, and talking points. The Community Health Training Institute is a project funded by the Department of Public Health. So this online training and all our trainings throughout the year are brought to you completely free. Thank you to the funding of the Department of Public Health. So we want to welcome you. If you've battled the snow to join us today, we appreciate it. In a second, I'm going to hand it over to our trainer. But before I do that, I want to explain a little bit about how this training is going to work. So on the right side of your screen, you should see your question and comment box, and that's where you will type in if you're having any difficulties throughout the presentation, if you have any questions for the trainer about the content, or questions for us in regards to sort of anything that comes to your mind as we go along, and we will receive those questions and answer them throughout the presentation. Immediately following this online training, we will have a survey that will pop up on your screen, and we would appreciate if you could fill that survey because that helps inform us throughout the year sort of what trainings people are interested in and how we can improve our trainings based on your feedback. And if you are on Twitter, we ask that you follow us at HRA Institute and use the hashtag MACoalitions because we will be live tweeting throughout this presentation as well. And if you wanted, you could sort of visit our website as well, hrainstitute.org, and find out more information. This is just a screenshot of what the question box should look like should any questions come up. Throughout the presentation, we'll also have a couple of polls for you to interact, and so you'll notice sort of the poll pop up on your screen, and we ask that you answer it so that we can create some engagement and conversation in the room. Again, I want to thank you for joining us, and I will hand it over to our presenter to introduce himself.
Good morning, everybody. My name is DJ Wilson. I work at Massachusetts Municipal Association as their public health liaison, and I'm also work on tobacco control issues. In both instances, I work with cities and towns putting in place policies on mass and motion issues and tobacco issues. So the learning objectives today are that all of you are attending will be able to better define a policy, systems, and environment change, and describe what those change examples would look like, and identify how you go about speaking with the right people and the right strategies to work in your scope of work. So before we go any further, I'd like to ask if anybody on the line are currently or previously elected or appointed officials. Okay, so what we're seeing is we see about 3% of you are, so a small number. So always think in the back of your mind that you too could run for office. So for out-of-state attendees, I know we have a handful. We'll be talking mostly about the Massachusetts municipal makeup of our cities and towns and what we have here in the Commonwealth. But please interrupt me if I'm not being clear, or if you have a question that's because you have a unique circumstance in the state to which you live in that you want to discuss. As an aside, let me just let people know that Mass Municipal Association, we are a membership organization for local officials, and we represent mayors, city councilors, town selectmen, town managers, and a few other smaller groups. Every state, except for Hawaii, has what are generically called municipal leagues. A lot of times, public health people do not think to work with their municipal league. If you're in Massachusetts, our website is mma.org. If you're in another state, you should Google something like State League, Municipal League, City and Town Association, something like that, and go to their website because you may find that they are actually working on issues you are working on. I would say that all the leagues have two basic criteria to all of them, and that is A, get the most state aid to cities and towns, with B, the least amount of strings attached. So all these leagues are focused on local issues, and it might be a good place for you to start and figure out on the issues you are working on. So most of you have seen this. The former head of the CDC, Tom Frieden, who was also New York City Health Commissioner prior to that, came up with this health impact pyramid that talks about why it's helpful to be working on the lower part of this pyramid, as we will be talking today, because policy has a much broader scope. This is not to say that, by the way, individual counseling and education and clinical are not important, but as you go down the pyramid, those things that you can put in place as policies are really changing the way people live for the better, makes the most impact. For example, here in Massachusetts, we are now in, I don't even know what year we're in. Oh, I think it was 04 that our statewide smoke-free workplace law went into effect. So, now while we changed the context by putting in a state law that says no smoking in workplaces, restaurants, and bars, what we've really done is, when you go below that, socioeconomic factors. Everybody in Massachusetts, if they walked into a restaurant and there was smoke, they'd be like, "What? What? I've never seen this before." So that really shows that you can make a big difference. So this quote is a widely used quote, and it really talks about how the different forces that conspire against us to get less exercise and to eat more poorly and to smoke and to do a lot of things that are counter to good public health or personal health. And so this is as I said, widely used quote. So what is policy? There are multiple meanings, and it can range broadly and narrowly. The general principles by which any government or entity is governed uses laws, regulations, and courses of action on any given topic. They can be voluntary, such as worksite wellness policies, and they can be mandatory, and we have here park and rec rules, for example, which, the park closes at 9 o'clock. Is that a good idea in August when it's still sunny for another hour? School district handbooks. This is where, a lot of time we are right now in Massachusetts dealing with updating school district handbooks to include vaping, not just tobacco, banning vaping use on schools. And local laws. We'll talk about local laws in a minute. So there's a handful of different municipal policies. Resolution is where you get a resolution from a mayor or a city council saying that we believe this X to be, we support it. But it's not a law. It can be an important first step to creating a law. A lot of times in Massachusetts, early on in tobacco control, a lot of our youth groups use resolutions as a way to get a foot in the door before a city council or a select board, and have them sign a resolution that, the Malden City Council believes a smoke-free future for our children is important, kind of thing. So it does get you that foot in the door a lot of times, and that was helpful in the early days of our program. Then local laws are passed by your local legislature. In towns, it's town meeting. In cities, it's city council. And that is pursuant to the Massachusetts Constitution. The Massachusetts Constitution is very broad, gives a lot of power to cities and towns to what's called Home Rule Amendment. And sitting side by side with that is a state law, Mass General Law, Chapter 111, Section 31, that permits boards of health to enact reasonable health regulations. Those two, and I should say, if you're an out-of-stater, the Board of Health issue is probably not available to you. You may have boards of health or health departments, but they may not be able to have this broad authority put in regulations that have the same import as a city ordinance or a town bylaw. So we focus on local policy because it does institutionalize change. Just like I was talking about smoke-free restaurants, no one in Massachusetts would ever think to walk into a restaurant and see smoking. And in fact, if they did, they'd complain in a nanosecond. And most of our signage that requires that they be smoke-free has the City of Boston's phone number on it, so a lot of those people would call up and complain in a minute. Evidence-based, the more evidence you have, the better. But there's a little asterisk here that sometimes you're doing something that is brand new. So how do you know that changing your minimum legal sales age from 18 to 21 is going to be helpful if nobody's done it? In the early days when we had youth groups getting cities and towns to ban tobacco vending machines, we knew it made common sense that if a kid didn't want to go up to a clerk and ask for cigarettes, that a vending machine was a good option, not a cheap option, but a good option for them to obtain cigarettes. But we didn't have much evidence in the early days, but we were sometimes the ones who made that evidence happen. And be population-based with a broad scope. Why local policy laws are more effective than, say, state or federal, it's easier to pass them procedurally. You're working with a smaller entity. In Massachusetts, it takes about 7 years to get a state bill introduced into the state legislature till the time it's passed, if ever. We do get opposition at the local level, but it'll be rare that it's from professional lobbyists. In Massachusetts, it's not uncommon for the same lobbyists we see at the State House to show up at the City of Boston for City Council hearings or for Public Health Council hearings. But we don't see that same thing happen in the other smaller cities and towns in Massachusetts. It generally receives broad community support, or they wouldn't pass it. And compliance rates are often higher with local laws because of local enforcement. It is very difficult to actually get a state to enforce, for example, tobacco laws, though I know the state of Maine does an okay job with it, but it's very hard to get state agencies to have the same kind of compliance that our cities and towns have. So there's 11 key elements of policy work, and that is to have a shared vision, a community assessment and information gathering, and this takes place, can take formally with formal polls, but also informally. The world is a very different place from doing policy 20 years ago. Today, you can just, you can Google a lot of demographics, so the city or town you're working in. You can Google local officials and pretty much find out anything about them. That took a lot more effort 20 years ago than today. Coalition development, we'll talk about that and how sometimes the typical partners are great to have around the table, but there's a lot of atypical partners that you may not have thought of. Policy education, making sure that the people who are working for this policy understand how the policy works, understands what the reach of the policy is, possible compromises, and how the process will go. Community education involves getting out information through media sources, either paid or unpaid, and just keeping your community, especially your local officials, apprised of what's going on. The remaining 6 are educating decision makers. This is a big one. This is basically what a lobbyist does, and I know that for a lot of people in Massachusetts, and for probably out-of-staters, you usually would get smacked on the hand if you said the word lobbyist. But in reality, what you are doing is lobbying. And at the local level in Massachusetts, that's possible to do without violating any lobbying laws. 7, opposition research. You'd be amazed by the most simplest of things that you think would be easy to get past, that would be a no-brainer, actually have opposition. So you really have to sometimes think out of the box. Obviously, the tobacco industry doesn't want to see vending machines go away. But you also have to think to yourself, are they vending machine companies? Was this a good way for restaurants to get somebody into the place? Why does the private club insist on having a vending machine? Will they be out in force against us? And to think those things through. 8, media outreach. 9, understanding the compromise options. It's obviously the way you buy a house. It's offered $500,000. You throw in $460. They come back with $480. You come back with $473, and that's kind of typical. So we understand that kind of compromising that happens when you're buying a car or a house. You kind of have to think these things through, what you'll be willing to live with if your local body, or especially your local champion, wants to make some compromises. You have to flesh those out beforehand and figure out that yes, we're good with that, or no, we're not. 10 public hearings we'll talk about a little later. And post-enactment strategy is after you walk away, the city council voted in the measure that you want them to vote in. Go ahead, go have a beer, go celebrate. But then you have to make sure that it's going to actually be put in place, because a lot of times you'll hear people complain, there ought to be a law, but once that law is put in place, don't enforce it against me. So post-enactment is important, because you don't want to have what you work so hard to put in place to then be ignored. So here's the second poll question. How many of you have met with any or all of the following elected officials: mayors, city councilors, town selectmen, health director, school superintendent, and for state, out-of-state people, that would be, you have county equivalents to that too. Oh, this is great. So it looks like a lot of you have met with a bunch of different people. So that's fantastic to see. And I should say, just as a note, though, I'm sure I tend to go ahead of the slides, but just as a note while we have this up, it is not a high bar to go meet with these people. A lot of times I will say to our local people working in the field that it's not impossible, it may take you a little bit to get in to see a mayor. But city council, selectmen, get before them and just introduce yourself, who you are, school department, school committee. You don't need to go in and have an ask, but just tell them what you do, give them the card, and let them make you their go-to person on the issue that you work on. So that's great to see a lot of people have met with local officials. If you are new to this field, we recommend that you watch the webinar we did last year, which was kind of Civics 101, and this is kind of Civics 202, to understand city and town government structures. We'll blast through it today, but there's a longer webinar that was done. And remember that local decision makers do go beyond mayors, city councils, and selectmen. Sometimes it's the person that you least expect actually has more power than they do have on paper. So just make sure you kind of give a broad look at who's working in city or town hall. And it's important to engage boards of health and other municipal committees and staff, especially staff. And we'll talk about one important staff member in a city or town hall in a little bit. So here in Massachusetts, we have 351 cities and towns. 56 of them are cities, 295 of them are towns. And just because that's the way of the world, they all kind of work under a similar theory, but of course there's exceptions to all of them. Most of these cities have mayors. One does not. Some have a mayor and a professional management person, such as a city manager. Others do not. In our towns, we have a town meeting, which for out-of-staters is that traditional town meeting that you see on a Norman Rockwell picture. Some are open town meeting where any member of the town can go in and listen in and vote, and others have representative town meeting where the population votes for representatives to go to town meeting and do that voting. We do have 14 counties in Massachusetts, but they are very weak compared to what other states have. For the most part, the only reason why Bay Staters know their county is because that's where they get their jury service notice from. Our court system is based on counties, but pretty much everything else does not. In fact, a number of them have been abolished. So a lot of what we'll talk about at the municipal level does translate to county level for out-of-state people. These are local laws. City ordinance passed by a city council and signed by a mayor. As soon as it gets passed, it can go into effect, but most cities and towns have a 30, 60, or 90-day start date. Town bylaws are approved by town meeting, and then they cannot go into effect in Massachusetts until the state attorney general approves them. I don't know the colonial reason that our forefathers believed in cities but not in towns, but they do require the attorney general approve it for that it doesn't conflict with the Constitution, that doesn't conflict with other state laws. That's not something that was put in place that's preempted by state law. And then health regulations, as I spoke of earlier, Massachusetts boards of health have broad authority to pass reasonable health regulations. And then executive order. An executive order is done by a president, governor, or a mayor, and it can be as light as this week is is Malden Uncle Appreciation Week, and it can, be much stronger. It could actually, ban smoking in restaurants. They could have. The one thing with executive orders is that extinguished at the end of that administration. So once the mayor or governor steps down, the executive order may be automatically extinguished, or it may be extinguished proactively by their successor. So what we run into in Massachusetts, and I'm sure this happens in other places, is getting the names of people correct. If you're before them, you want to make sure that you're saying it correctly. So we have Board of Selectmen in Massachusetts towns, but some towns are switching to Select Board to make it gender neutral. We have City Councilors and Board of Aldermen. Most cities use the City Councilor term. We have a handful of cities that use the Board of Aldermen, and Newton just switched from Board of Aldermen to City Council to make it gender neutral. Professional management starts with town manager having the most power, and they oftentimes have the power to appoint, manage, and fire a lot of key officials in town hall. The next down is town administrator. The next down is executive secretary, and then administrative assistant is really what it says. It's the administrative assistant to the Board of Selectmen. It is helpful to know when you're talking to town management people what their actual title is. Then for boards of health or health commissions, there are 3 different titles: health director, health commissioner, and health agent. Good to know which one is each. But what is easiest is a mayor is a mayor is a mayor. Very easy to call them mayors. So my colonial select woman story is 1,000,000 years ago. I was at a meeting, and I knew that there was a woman in the office who was a selectman in a suburban town here in Massachusetts. Ended up on the elevator with her after the meeting. I said, "So, do you like being a select woman?" And she berated me for calling her a select woman, and said that our colonial forefathers said selectmen, and she insisted on being called a select man. So this is why it's helpful to know that you get the terminology right, because you don't want to stand up in front of the Board of Aldermen and call them, "Thank you, city councilors, for having me before you." You'll just have lopped yourself off at the knees. It's not going forward.
We seem to be having some technical difficulties, but
there we go.
Takes a second.
All right. This is the one person in town that is oftentimes overlooked and that you should make friends with. The city clerk or the town clerk, they are the repository of all official records. They have a ton of information unofficially. Sometimes the city clerk is sitting next to the city council president at every meeting. They are just a great source of what's coming up, upcoming commission meetings, committee meetings, who's who, how you post public hearings. They know it all. A lot of them have been around for a long time, and for a while we assumed all of them smoked because they were the biggest problem in city and towns halls when we made large smoking in those locations. But so it's very helpful to have them, to introduce yourself to them and make sure that they're not your enemy, because they'll thwart you. Transparency. Open meeting law in Massachusetts means that every governmental body shall be open to the public, and any person shall be permitted to attend that meeting. So a lot of times, sometimes what will happen is we'll be in a Board of Health meeting, and someone who's in the audience, there'll be noise outside the door. Someone in the audience will shut the door, and you actually can't shut the door. You have to leave it open to comply with the open meeting law. Now, one time we did have somebody in the audience say, "There's no seats for me. This is in violation." Open meeting law doesn't care how comfortable the person is. They do care that the person can hear and see the proceedings, and that extends to being in a different room with a video monitor watching the city council hearing. We are sensitive to the fact that if a Board of Health, if you think that you're going to have a hearing that's going to have a million people show up, make sure the room is big enough to hold them. So you don't want to be in violation of the open meeting law. Public records law. Let it be known that anything you send to a city or town becomes open record. The public can ask for it. So that includes emails. This is the reason why even today, with every lobbyist holding one or more smartphones in their hands, they still make phone calls. If you think you're going to talk about something sensitive with a local official, call them. Don't put it in writing. It becomes a public record. And lastly, Freedom of Information Act, or FOIA, is a federal law that has a procedure for a citizen to ask for information that is in a city or town hall. And this, for us, we're very sensitive, especially for tobacco control, because the tobacco industry knows they can do this. A question just came in, but I lost it.
Says, are open meeting laws federal?
No. So they probably change ever so slightly state to state. So you should look and see what is happening. I would say if you're in another state, I would go to your Secretary of State's webpage to find it. Any other questions? I should also say that the federal government probably has their own open meeting law for federal proceedings, but they don't translate to state or local. So, foundations of an effective policy. Having a clearly defined issue or problem is most helpful. Most of you will have this, but it doesn't help to go in and say, I want to do something about, I don't know, sidewalks. What? I don't know. So it helps obviously to figure out those things ahead of time. Strong, credible documentation of an issue or a problem. We will talk about this a little later, but that documentation is best. The more local it is, the better it is. So it's most helpful to show. I'm trying to think of a couple of examples, but to show the sidewalks in this town are problematic. It doesn't matter what the other towns have as a problem. It's helpful to show that sugar consumption is up in Massachusetts rather than California, and that kind of thing. So the more local you can have documentation about an issue or a problem, the more helpful it is. Even a simple poll is better than national data. Evidence-based, we talked about that earlier. And again, with Google out there, you can find a lot of what you want, but be wary of, as it is true with everything that's on Google, is that some stuff will be very helpful and other stuff will appear to be helpful but not be very helpful. Be careful with the sources. Your own past experience, or the past experience of the colleagues who are helping you work on this policy. A diverse, broad-based community support. Sometimes, especially if you are if you happen to be the local gadfly who's complaining about everything, it is helpful to have other people around you who can also bolster your argument. And it's also helpful if you are not, say you're working in the field but you aren't from the town, it is helpful to have town residents with you, because a lot of city councils and selectmen will first ask you, where do you live? And that your objectives and goals are feasible, that they make sense, that they can be enforced, that does solve the problem at hand. So what is a valid policy? Evidence-based is best, but as I had talked about, sometimes things go forward without it. Hot topic in the news. Here in Massachusetts, we had a couple incidents where there was upskirting, guys taking pictures up women's skirts, and because it was hot in the news, it became state law in about 8 minutes. It was so fast. It was within a week that the legislature had a bill put in, and they passed it immediately because it was a hot topic. We often, and some of this sounds maudlin, but a lot of times in Massachusetts, what we see is, say, there's a bad fire and a couple firemen die. The firemen's lobby run to the State House and know this is a good time to put something in for an additional holiday or a pay bump or whatever they may do. They're very good at doing that. Doing your research, obviously, helps, and talking to people who understand your policies. A lot of times you don't have to reinvent the wheel. There's usually somebody out there. It may not be in the town next to you, but it may be somewhere in the United States. Somebody out there has thought about what you're doing and may already have done it. So it's helpful to steal from others. And entities exist nationwide that deal with state and local policy on your issue, whether it be environment or tobacco or nutrition or better labeling, climate change, whatever it may be. There's somebody out there who's working on it. And as what you are doing is preempted. So what preemption is, I mentioned it quickly earlier. So preemption is when a higher level of government puts into place a law that says a lower level of government can't act on it. So, for example, here in Massachusetts, we're lucky that our statewide smoke-free workplace law is anti-preemptive. It says right in it that cities and towns, which are often called political subdivisions, our cities and towns can go beyond that law. And so that it's very clear that cities and towns can go into the exemption for, say, private clubs and make private clubs be smoke-free. Conversely, we have a state law that says you can't sell plain rolling papers, like Easy Widers, to anybody under 18. And no city or town can regulate this further unless the measure was put in prior to 1987. So that means today, we can't have a city or town say, well, we just raised our age to 21 for tobacco, we want to raise it for rolling papers. They can't do it because state law prohibits that from happening. Where the broad preemption happens a lot in Massachusetts is that now and then you'll think to yourself, well, let's see if we can put a local tax on something. Cities and towns in Massachusetts can't assess their own sales tax or excise tax except for in two areas, and they have to do with a surcharge on the restaurant tax or the hotel tax. So you can't, unlike New York City, we can't do a local cigarette tax in Massachusetts. So finding local officials and decision makers that will be helpful for you. Identify the key supporters. Sometimes it's very obvious who those are. Learn their biographies. One-on-one meeting is best. It is better if you are a resident. If not, bring one with you. Involve key people in the community who understand and agree with what you're trying to do. Update and inform and become that go-to person on the issue. So after you have a successful meeting with a key supporter, keep them in the loop. Don't let them go after you get the information, because you never know that they could be very helpful to you down the road. So years ago, someone in Massachusetts, I believe, came up with an interesting graph to figure out who those stakeholders are, and this is what it looked like. So it was so if you were trying to talk to your mayor or your town manager, and they were in the middle, these are the things that you want to find out about around the fringe of it. And so just to go, like, for example, the one that's at about 5 o'clock, personal history, family, and friends. Are lobbyists on tobacco control? No. So the lobbyist from American Heart knows what legislators have had a heart attack. Our lobbyists from American Lung know who's had lung cancer. They're very aware of what those things are, and it sounds awful to do, but these things are very helpful. To know if they have kids in the school system, to know if they smoked in the past, if they have smoked. Boston Mayor Walsh, he comes out very openly that he's a recovering alcoholic, and so knowing that is very helpful ahead of time. Who their financial supporters are is a little more difficult to do at the local level because it's not the same kind of follow-up. It just hasn't come out. If you're running for city council, you're talking about a lot of $25 to $100 donations compared to someone who's running for Congress. But it's still helpful to figure out who those financial supporters are. Where do they get their news? I live in a suburb called Malden. It has a weekly and a daily newspaper. And, you don't think there's much in them, but you can be sure every city councilor reads it and gets those and reads them all the time. And, there may be stakeholders that I am missing. So think broadly about, how much influence does the head of the YMCA or the YWCA have, the Boys or Girls Club? In Malden, we have one place that really is the place to hold an event. It's the biggest hall, And you don't think that makes any difference, but it does, because every local official knows and has been in this place for a kickoff campaign or MLK luncheon. So everybody knows that. So think broadly about the stakeholders that could be helpful to you. Membership associations as well. So this is very Massachusetts specific, but if you're from out of state, there's probably equivalents in your state. These MMA, this is who we represent. MAHB is Mass Association of Health Boards and the Board of Health members. MHOA.com, our health agents and health directors. There's a organization for planning directors, an organization for general public health advocates, an organization for school superintendents, school committees. There's one for teachers. They all have their own websites, and it may not be bad if you are working on a policy that is going to intersect with these people to go on those websites and poke around and see what you can find and see if it can be helpful to you. So before meeting, a note on I have a handful of notes here to think about. Champions. Sometimes, a genuine champion needs education, support, and for them to be your wingman. Sometimes they literally will want you there at a meeting, sitting near them, just so they'll look up and say, is that right? Or do you have any more information on that? And you literally will have to sub in for them and talk about the issue, because you can't expect them to know everything. But educating them as much as possible, supporting them with information as much as possible is very helpful. However, be careful of the following. An opportunist champion, we get nervous when we see a new elected official come forward right before election and they want to grab a policy that we've been working on and make it their own. Are they doing it just for the election season? If they are, and they're genuine, okay, but just be careful about it, because you don't want to be pulled into their election issue. Sometimes we get the crazy champion, the person who's on the city council who's known by everybody to be crazy, but they're the ones who want to work on your issue. You just need to be aware of it, and you may need to contain them. And then the rogue champion are somebody who in the beginning agrees with you, and then but they're quick to compromise down below a level that you're comfortable with, or sometimes they actually vote against you, like they were your friends and then they voted against you. So just be aware of that. Keep tabs on all your champions to make sure that they remain a genuine champion. Another note on elections and campaigns. On your own dime, time, and phone, it's your call to do whatever you like. Some state-level lobbyists go to every fundraiser, and some go to none. Our lobbyists at MMA go to none, because once you start going to one fundraising breakfast, they feel like they need to go to the other 199, and so they go to none. But others go to a lot of them. So you could make the decision at the local level whether or not it makes sense for you to go to a fundraiser on your own time with your own money. Sometimes it makes sense, especially if you're a genuine lobbyist. There may be valid reason for you to throw them some money during re-election. You could also limit yourself to just those elected officials that represent you. And this is kind of the take I take on this issue, because I get asked to support people that don't represent me. They're not my state rep, they're not my state senator, they're not my mayor. And so I beg off on those. But the ones that do represent you, if you want to justify why you're supporting them in their election or re-election bid, then that might be a good way to go. If you work for a non-governmental entity, it is good to talk to your boss about what policy that non-governmental entity has. If you work for a governmental entity, you can do as you wish, but make sure you're not doing any of it on their dime. One issue is, what do you do when your boss is running for re-election or election? This is something that you'll have to think through. You may have no choice but to help, but just be aware that could happen. And what do you say and this comes up a lot for a lot of people, I think, in my field. What do you say when you're at the fundraiser and they say, and what do you do? And you don't want to tip your hat that you work for the state or on a state funded grant. So a lot of times myself, I'll say I work with cities and towns on local policy and leave it at that. But it does throw you off base because you're like, oh, I don't know if I want to say that or not. So just to be aware of these election issues. Municipal timing. So in Massachusetts, cities elections are on the traditional second Tuesday of November. City councils get reelected every 2 years. Mayors, some have 2-year terms, some have 4-year terms. The best time to work with a city. So we just had our elections in November. So our new city councils have all been seated, and our new mayors have all been sworn in the last 2 weeks. Now is the best time to actually go forward with policy because they are the furthest away from their next election season. So a lot of them will think to themselves, I can stick my neck out on this issue a little further than I normally could, because by the time it gets in place and people have calmed down about it, and it's working nicely, then election comes up, it won't become an election issue for me. Be aware that at most city councils, it's the subcommittees that what will typically happen is that a policy will be entered into the full city council. It will be referred to the proper subcommittee, and that committee will be the one to write up the law, hold the hearings, and then vote back to the whole city council whether or not they want this full city council to vote yes or no on it. Town bylaws. Towns are a little different. Towns typically have their election season in the spring, usually somewhere between March, April, May is when most town meetings happen, and the town elections happen right before or right after. And again, once that election's over, you are primed for the best time to actually get your selectmen to act on something. In both instances, this is more true with cities than towns, but that gap of time between November and when they get sworn in January represents a really nice time to go meet the new councilors or new mayors. They aren't in office yet. They're not deluged by their new power and their new responsibilities, and it is a nice time to go and introduce yourself. So when do you engage a local official on the issue that you want to move on? And it really comes, it's very individual for different cities and towns and different personalities. Confer with others in the know. Really talk to people who've been through a local campaign, and that may be a city councilor. A city council may be very helpful in telling you, now's not the time to do it. This is budget season, but I think what would be really helpful if you came forward in, say May, before we go on a skeleton schedule for the summer. May might be a good time to start this. So it is helpful to figure out when you're going to have your best time to meet with local officials. You don't want to meet them too early while you're still in that. I think we want to do this, but you don't want to be too far forward, especially if it gets in the media. If you sense that consensus is going to be important, it's a call to make. Do you have this big blowout meeting with all your advocates from the very start, or do you meet with them individually? Because you also have your campaign should also not even be talking to local officials, but the advocates you want by your side for the whole process. And who do you engage? Everybody wants to meet with the mayor. Our Mayor's Association is very popular with lobbyists and companies that do a lot of municipal bids. And they, I'm on my city's walkability committee, and the mayor put it together. He was able to put on that committee, because he's mayor, the head of DPW, a handful of someone from his office, a handful of advocates. So he was able to push together a number of people, that the city planner, that otherwise, if you did it yourself, would be helpful. But everybody wants to talk to that mayor, so you need to think it through because if that he or she shot down your idea from the beginning, where do you go then? So sometimes talking to others about is he or she the best person for me to go to first, or should I be talking with others in his office, or is it better to stay away until this gets better formed? And so it's that classic 6 degrees of separation. You'd be amazed, even in a city the size of Boston, who knows who. So it is always helpful to talk to your allies about, to throw out there, is it helpful for me with X, Y, Z, or should I wait, or should I put them all together in a room, kind of figure out what makes sense. And then there's a lot of unlikely allies. I've brought this up a couple times prior, but you just never know who might take shine to the policy that you're trying to put in place, and be broad about it and go talk to them and see if they actually are on your side and be willing to help at some level. And staff might be your best bet. As I said earlier, you might actually do better talking to a staff member of the mayor than the mayor, him or herself. But that's a call you need to figure out. And if you talk to your allies, they might be able to tell you who the best staff person is. Best way to contact a local official. We get a lot. All of us get a lot of sign up for this email to tell Congress to get rid of XYZ. And it's basically a chain email with standard language. That doesn't get you very far. It still is true that calling or meeting them in person are the two best ways to make an impact with a local official. And remember that if it's in writing, it's official, and that is open to anybody getting their hands on reading it. So still, phone calling or in-person meetings is not a bad idea. A lot of times, city councilors, state representatives, state senators do have in the district, in your city or town, a coffee hour where you can go just talk about anything. That might be a good time to go talk to them, where you're in a coffee shop, phones down, nothing written, and just really get a sense of where they stand on issues that you're interested in. Sometimes we've all run into this as well, not only professionally but personally. You call them up and you get their voicemail. Do you leave a voicemail, and how do you say a voicemail that never gets returned? So one trick is to obviously say in the voicemail, I will follow up with you next week if I don't hear from you. And you can do the same if you are writing a letter to them saying, by this deadline, I will call you. I have a deadline. I'd like you to make a decision. If not, I'll call you. And I have in here a little subgroup that says ribbon cutting ceremony. So sometimes it's just seeing people where they are. Mayors, city councilors, selectmen, they all, for good or bad, have to go to every ribbon cutting, every parade on Memorial Day. And sometimes those are the good places for them to get to talk to them and let them know that you are also interested in the community the same way they are, by showing up for some of these things. At a decision maker meeting, thank them for any prior support that they may have. Keep it brief and concise. Be aware of where you meet them. Sometimes if you're meeting them in their office, that they will easily be distracted by the next shiny thing. A phone call, a staff member coming in and saying, I need you to talk, and then off they go. So if you do meet in their office, it's very helpful to be brief and concise about stuff, because they may have said, I'll give you a half hour, but in reality, you might get 10 minutes or less, and you just have to really pound through the important stuff that you need to get out there first. Bring some additional education materials. As I said earlier, try to be that go-to person on their issue. To say to them, thank you. I get it that you have to leave. Here's my card. Please, anything having to do with tobacco, any idea you have on this, anything you see out there, please give me a call. Be their go-to person on this. Thank them for making time to meet with you, obviously. It's very helpful. And it's also helpful to even send a follow-up note, thanking them for their information, and any hint that they came out with a question that you didn't have a great answer for, or that has data out there. It gives you another
time to have a second interaction with them by sending that thank you letter and saying, oh, by the way, you had mentioned if there was any local data on opioid use. This is what I did find. Please see it attached. Call me if you have any questions. So being clear and concise is helpful. Factual presentations, the more local the better. Identify community concerns, being very specific about issues that you actually see out there. Again, tobacco. If you were meeting with a mayor, to actually bring the grape cigar, bring the vape pen that looks like a candy cane, bringing those things and say, I bought this here in this city. This is what we see. Identify the benefits of those decision makers, community members, and individuals. A lot of times that'll come down to public health, general public health, and then follow up with additional information. As I said earlier, it's a nice second touch that you would have with this local official. Handouts. Which one will a local official read? The 334-page report will never get read by any of them. If you want to have one of that report on hand and say, please find attached this 4-page summary from this had to deal with raising the minimum. This is a federal report on raising the minimum legal age from 18 to 21. So it's important to be able to say that the Federal Institute of Medicine came out and said that this is a good thing to do. I will tell you, though, probably neither will get read. But why waste the money in printing up the huge report? Keep one handy in case you have some real person that you're talking to that really is interested in reading the whole report. It'll be very rare that they do. But even the 4-page summary is really hard for them to read. Keep in mind when a selectman or a town or a city councilor comes to their meeting once a week, once every other week, they swing by their office, they pull out a pile of mail in their mail slot that's 2 to 5 inches high, and in that are 1,000 different issues that are coming up. Different policy issues, different asks. Please attend. Please go. I can't believe you're doing that. A complaint about kid not getting into state college. It runs the gamut. So you want to be able to hand them something that's easy to read, quick, but be able to say, this information comes from the Institute of Medicine. If you want the summary, I have it. If you want the full report, I can get it to you. And local data is best. So I know sometimes if we sit down with epidemiologists at the state level and ask, how can we find out, so for example, this is one that is actually true. The town of Northborough, Massachusetts, back when firemen and state and policemen were mandated to be smoke-free by state law back in the late 80s, Northborough went ahead and redid all their city contracts with teachers and anybody else that they also had to be smoke-free. So the town of Northborough may have a completely smoke-free municipal workforce, and that's amazing. There may be nobody else in the United States that does it. But when I talk to the epidemiologists, they're like, it's too small a sample, we can't help, we can't do it. So unfortunately, you get kind of trapped by something that sounds really promising, but then the data from a professional point of view just isn't working. But sometimes your local data doesn't need to be that fancy. So we did this Operation Bar Hop I have up here. So we were running into the issue where the opposition and some local officials would say to us, well, obviously if you walked into Joe's bar and there's 50 people and the place is filled with smoke, most of them are smoking, aren't they? And this will be very unfair to them. But we kept on thinking to ourselves, it's probably far fewer smokers are actually in that bar because just 1 or 2 cigarettes really causes a lot of smoke. So we did this Operation Bar Hop. One night we had teams of 2. I can't remember how many we had in the 15 teams, I think. Simple, couple pieces of paper and a pencil in your pocket. We just walked in. And you kind of gave that look like you were looking for somebody. And one of us counted the number of people in the place. The other one counted the number of people smoking. You went out, you noted it down, you came back. And what we did, in fact, find was 1 or 2 cigarettes caused a room to be very, very smoky. And we were able to go back to the city of Boston and say, these are the places that you, as a city council or a public health committee member, these are the places you go. You know there's smoking, and it's not because everybody's smoking. It's because very few people are smoking, but the smoke causes a lot. The smoke from those few cigarettes causes a lot of public health damage. So something like that. Be clever about it. We have our youth group in Malden has done, just number of counts of people leaving the subway station. So at rush hours, both morning and afternoon, to count the number of people who are walking, biking, rollerblading, in a wheelchair, pushing a carriage, just so you can go back and say to a local official who thinks that nobody ever rides a bike to the T-stop. No, it's not true. Our counts show this. Whether or not this information would pass epidemiological muster, I don't know. But it does show that you did the legwork for them in a place that they know of, and it's where their constituency lives. If you don't have the capacity to do that, but you found some really good out-of-town data, pick your comparison communities carefully. Cities like to hear from other cities. They don't really care about towns. And I will say, in Massachusetts, data for other cities and towns don't care much about data from Boston, Newton, Brookline, or Cambridge. They don't think that those towns look like them or act like them, so try to find ones that have similar demographics or nearby. A unique out-of-state story might work. Again, the equivalent to showing Cambridge data is to show California data in Massachusetts. People just won't believe it. But if it's really unique and different, you might be able to sell it. But the more local your data is, the better. So a public hearing. It's always true that a city council will have a public hearing. Town meeting is basically a huge multi-night public hearing. And boards of health don't need to have public hearings on most of the issues before them, but we do recommend that they do them just so they can't be. No one can complain later that they had no chance to speak. But as soon as an entity decides to have a public hearing, a lot of things jump into place. So it's held by a government entity in order to receive public input on a proposed policy. We try to train our local officials. City councils do it best. Town and smaller boards don't do it as great a job, but just receive public input. Don't answer these people. Don't get in a fight with these people. Just give them public input. Invariably, you'll have the first person stand and say, I can't believe you're doing that. Why are you doing it? It's really hard for them not to answer, but the answer is, this is the policy before us. Please comment on the policy and let us know what you think. Some policy will have multiple hearings before different subcommittees or boards. This is very true at the state level. They must be posted for the public to know. In Massachusetts, not only does it, in Massachusetts, kind of the city clerk or town clerk will be able to guide the board as to what that proper posting should be. But in Massachusetts, oftentimes it is a summary in a local newspaper, a physical posting inside City Hall, and now by state law, that posting needs to be visible and 24/7. So we have a lot of cities and towns that have either put up something on the outside wall that's covered by plexiglass with, filled with index cards to tell you when the hearings are coming up, or some have a computer monitor facing a window at city or town hall, so people from outside can look at that. So that's a new rule for us in Massachusetts, only a couple of years old. So at the hearing, please, outreach to your residents to give input who are on your side. Know your proposal really well. That's really important, so you don't get caught up in, did you see on page 3 that you wrote this? Did you mean that to happen? You need to know that backwards and forwards. And you need to be the person in the room who knows that. Yeah, it may have to be you. Don't expect other people to do it. Have evidence-based documentation handy if they ask for it, but you don't necessarily need to give them a pile of paper. Track the testimony. You may have somebody in the room who testified in favor who, you didn't know was an advocate. So you want get in touch with them later. Or you want to find out what the opposition is talking about, because, we oftentimes have, in tobacco, a store stand up and say that they hate the new policy, but our really clever tobacco control directors will be able to know right on the spot that store just has been caught 3 times in the last 3 compliance checks selling to minors. That's a very impactful thing to say to the Board of Health. FYI, Joe's Variety, who just testified, he was caught and just got done with a permit suspension because of repeat offender. Any additional rebuttal information that, the hearing has come to an end? People have rebutted some of the stuff you said. Get in any additional information to rebut what they said back to those local officials as soon as possible. It's also another way to contact that official and let them remind them that you're out there. And then think about your possible compromises. So we actually have gotten so far as writing up a protocol. This is just part of it. But if you are close to working with a Board of Health or a local entity, that city councils and town and select boards in Massachusetts pretty much have somebody sitting next to them, either the city clerk, town clerk, or the town manager next to them on how to run a public hearing. So that's usually done much better. But the smaller, more minor boards don't always do hearings, so it's very much a new thing for them to do. So we actually have them read this verbatim. They fill in the bolded parts and they read it verbatim, just to calm down the audience from, who do you think you are? Who are you people? I don't understand why we pay you. This clarifies a lot of it right off the start. Then for preparation, this is for you to, so this is actually talks about, so this is something for you to do as an advocate. Kind of think about what makes sense, that information that you need to have right then and there. And the example I just gave you was about the Joe's Variety has been caught 3 times. This is the kind of thing that if you have right in front of you, it means that you're right on the down. You're really on top of everything, and they'll be very impressed if you can answer those questions right there. A couple things about what audience where you're sitting at town meeting. Town meeting, the only people who are supposed to go are people who are residents. If you're an outsider, they will actually usually corral you into one corner of the room to make sure you don't vote on it. Oddly enough, if you're an outsider, you go to a town meeting for this purpose, you'll be sitting next to people like the school superintendent. You'll be sitting next to department heads, the police chief, because it's not necessarily true that those people live in the town, but they need to be there to answer any questions that come up. But they also are non-voting. So, but what's very helpful for advocates to recognize is that if you are not an eligible resident at town meeting, to get you to vote, to speak, is a really uphill battle. Town meeting must approve that you are allowed to speak. So and then you're just seen from the get-go as an outsider making a speech. So you do best if something that you're working on has to go through the bylaw route at town meeting. You really need to train residents to speak on your behalf. City council, they're as I said earlier, they're more protocol driven. They have their own protocols, and they're pretty good about not letting it break down to conversations and going back and forth and fudging the rules. But they may have a protocol as to when you can sign up. You might have to sign up earlier in the day for a hearing that's at 7 o'clock at night. So those are the things you need to figure out. And for city council and select board, there's usually a packet that's probably put together for the members. Say if they're meeting on Tuesday, they get the packet out to them on the previous Thursday. You have to learn what that is, and if you're going to have a handout, you need to make sure that you get it to those offices ahead of time, so it gets them in a timely fashion. As I said earlier, Board of Health and others, usually they're more casual, and they try to figure out their protocol. Unfortunately, sometimes they're figuring out their protocol live, as your opposition is standing up for the 6th time to talk. Well, it's broken down to this fireside chat. It's torturous. So that's why it's helpful to say ahead of time, if it be for a Board of Health or some other smaller board, do you need help figuring out how to run the hearing? And then, give them that kind of introductory thing. Say, what you should do is only let people speak once. Allow them to write in. If they want to get up a second time, they can send you an email to this address or write to you in a letter at this address. And just so you're not there, just going back and forth till midnight. Training your testifiers. So avoid the local version. It's local. Avoid the local version of a form email. It becomes very clear when a state rep gets the 700th pre-printed card that the person only had to scribble their signature and they can't read what it is. Those aren't very helpful. So try to avoid that. Have them tell their personal. I should say for the form email, one thing that did happen nicely for us recently is a youth group in Springfield. They did that kind of thing on a postcard, but then each student wrote how tobacco has affected them, adversely affected them or somebody in their family. So it did personalize that email. So that was a nice thing, or that index card that they passed in. Have people tell their personal stories. That's they just need to say, yes, I support this, and this is why. In my personal life, this is how it plays out. This is especially true for kids. While we do have some young local officials, you can be sure that all local officials are going to be 18 years or older. And most of them, including myself, have been out of the school system for decades. So hearing what is happening behind the doors of a high school or elementary school is really important for kids just to share what they see. Passion is good. Yelling, not so much. Nor is crying. So you want to say and to not be ranting and raving because it doesn't help your side at all. The timid testifier. There's a lot of them. It is not uncommon as you get to a hearing and the person who's coordinating getting people to show up for the hearing are like, I have 7 people who are going to come. And you're like, that's fantastic. They get there. 6 of the 7 don't want to talk. They're just too nervous. So if you could coax them to say, at a minimum, these 4 things. Most of the time, a city council, select board, or board of health want you to say your name and address, period. All they have to say is, hi, I'm Joe Smith, 36 Maple Street. I support this measure and I hope you do too, period. And then again in Springfield, what they would do is they'd have these, a couple kids speak, then the other 8 kids behind them just come up to the podium and just say, Joey Smith, 8th grader, Springfield Middle High. That's all that's necessary, just so you get on the record that you have another resident who is for this. And then ask if there's a write-in period for those people who are too shy or didn't show up or couldn't show up at the hearing. Is there a write-in period for them to just send something along in written format, either email or in a letter format? And again, talking about that they support it and their personal reason for why. I should say on that last slide, though, sometimes you'll also get to we are sometimes surprised by like an MD who will show up that we didn't know existed, and they'll be for us. And so it's very helpful to pull them aside, talk to them, and see if they could even address if some lingering question dealing with that they could better answer than yourself, or has more import coming from an MD to say afterwards. Oh, there was this remaining question about vaping rates in the junior high. Is it okay that I put together a letter, and can you sign it if you're willing to? That might be very helpful. This happens a lot. How come I learn of these meetings or these hearings too late? Like you read about it the next day in the paper and you didn't know it was happening. So this is just grunt work that you got to do to let people know that you are out there and want to know. So the first bullet talks about this, the Massachusetts mandating to post meetings. So you have to keep your eyes on that. Read the local paper. Go through the legal notices in the paper once a week. Make it, just say this is something I need to do all the time. Usually it's on a good municipal website as well. There's a calendar that you can click on and see what's happening for the whole week. Ask to be on their email list so you can scan the agendas to see if there's something you should know. So the Walkability Committee has asked the planning board secretary just to always send to us their agenda. A lot of their agenda has to do with, widening a driveway or something, or adding an in-law apartment, things that don't matter to us in walkability. But now and then there is something in that. So it's worth them sending it and going through their agenda. 2 minutes is all it takes to see if there's something on it that you should know about. Ask the department heads of those committees to keep you in your loop. And again, it's a fine time to be best friends with your town clerk or your city clerk. So you're lost. And you may have lost for a bunch of different reasons. You didn't have the momentum, the votes, timing was wrong, you were too close to an election perhaps, or the proposal ended up being too watered down, or was too rigid. Don't give up. You can regroup your supporters, talk to those champions, because if you've already had a vote, you'll know who those are. Talk to them, ask them about what next steps should be taken to get through this. Think about talking to the local officials in opposition and ask them what they found that was wrong. Make a true assessment of what's right and wrong so you can, really hammer down what you should do next time. And I said earlier, it takes 7 years to get something to the Massachusetts legislature, is the average. But do keep in mind that, for town meeting, it is typical that town meeting does not want you to come back every time town meeting is held and try to push the same thing. So talking to your champions will be able to tell you, does it make sense to go right back and do this, or does it make more sense to skip a town meeting season? Does it make sense to wait for the new city council to be seated? And your champions should be able to help guide you through that. Any questions? Okay, having none, here's a couple examples that we do. I'll just blast through them because I know that there's a lot of writing here on the Complete Streets one. So in Massachusetts, in the United States, there's this theory, complete streets. And what it is when you're building new streets, sidewalks, and intersections, to make them accessible not only for cars, but also for public transportation, pedestrians, and bicyclists. But more important in Massachusetts, where we are so built up, it's to go back, it's to when a road is being dug up or an intersection is being fixed, to step back and make sure that all 4 of those modes of travel are covered. And so we've been trying for a long time to get cities and towns to do this, and not make cars the king is the way to go, but to step back and say, what do we do about making sure bicyclists and pedestrians are served well? So we had a fair amount of success. A lot of cities and towns have seen complete streets as a way to encourage people to move into the city who want to be able to bike, want to be able to walk to a store, don't want to rely on cars altogether. Especially when we are now seeing that, especially millennials are not rushing to get a car like I did when I was 16 and a half. So they are happy not to be car owners. So because these cities and towns are in competition with other cities and towns for, try to get the next Trader Joe's or the next condo building. The smart ones have stepped back and figured out that they need to try to do this complete streets thing. So, but it was an uphill battle a lot of times because especially if you had like a planner who was near retirement age, they were just not interested in this newfangled kind of policy, but they were willing to listen to you. But then something amazing happened, and that the state of Massachusetts put some money aside for our Department of Transportation to fund a complete streets program. So the first step to apply for the money was to adopt a complete streets bylaw, ordinance, or administrative policy. Then it would be approved by DOT, and then then the next step would happen for a listing of projects that they wanted for the next 5 years, and then funding would be given out. So a local hearing was required, and so that meant that for people who were for this, even if they, as soon as you said to local officials that money was involved, it definitely ramped up the importance pretty quickly. But it still meant that a local hearing was required, so we still had to find advocates. You still had to make sure that you weren't sideswiped by the head of DPW, the city planner, and a host of the zoning board, a host of other people who would come out and say, no, we're against this. So you had to identify the body that this is going to. You had to identify, write up the policy, and at this point we had some best practices. It was nice here that Littleton, the town of Littleton, had won a national award from a Complete Streets entity. So we were able to say, just copy what Littleton has, or don't start with a blank piece of paper, but start with Littleton as your framework and go from there. But we did have to make sure that you had a lot of any board or department that was going to be involved on board. And then we had to identify a baseline inventory for pedestrian bicycle accommodations with the help from DOT. So this is a place where you could, sit down. If you had some interns who would go down and sit at your busy intersection and count cars, count bikes, count pedestrians, and figure out where the heaviest use is, to really watch where things are going right or wrong. And unfortunately, sometimes what propelled action on this would have been a pedestrian accident or a bicycling accident with a car. And so there was a review process that needed to be put in place, a municipal goal for increased mode sharing with walking, cycling, and public transportation. And so while there were a handful of DOT requirements that typically were easier to handle than the typical way for a city or town to get money from DOT, they still had to get done. But it was that the ability to hang over their heads that there's money out there really got people to the table faster and better. But for detractors, some of the things that were helpful was this. Here's a material that we used. This is just a partial list of the cities and towns in Massachusetts that put the Complete Streets policy in place. I do this for not only Complete Streets, but I do it for a host of tobacco policies. And the reason is cities and towns love to see what other cities and towns are doing. So if you're a city, I have the cities in bold, because cities go straight and see what other cities are doing. And they're impressed when they see, they may not be impressed here that Boston did it, but they might be really impressed that Braintree did it. Like, Braintree did this. And, they might be able to get in contact with Braintree and say, how did you do this? Can we see your policy? Can we copy yours? So then with the information below that, number of cities and towns with it, what percentage of the state lives under this, it's all to make it look like, not only to look like, but it is true, that other cities and towns have done this. You are not alone. You are not unique. And this is the normal way of doing things. Calms them down that you're not some crazy person who just walked in and decided you want something done. This term, Complete Streets, that they've never heard of. So I do a little bit of a history is on this list as well. And so I will caution you the one thing that's wrong with this list. So this list has 148 cities and towns listed on it. If you're doing cities and towns that have banned German Shepherds from parks, and the list is one town, it's not very impressive. So these kind of lists aren't very helpful until you get further along. And if you can really pull off on this, I will say, if you are very clever on a computer and can pull off a way to do a map of your state and what cities and towns have done these, local officials love to see a colorful map. They are drawn to it like a bee to honey. Some other materials that would be helpful, actual policies from neighboring or similar municipalities. In Malden, we had the one from Medford. Medford looks very similar to Malden. We share a border. Prioritization plan was the next step. That's that 5-year list of projects that you want the state to fund that'll promote Complete Streets. Also carried with us the Medford prioritization plan, so they saw that what it looks like, that it's not this incredible burden that's too difficult to do. Then, there's a lot of places that you can go on the internet, or you can do it yourself with before and after pictures that identify, roadways that were once awful to walk down, but now are better. And so here's, so the typical thing is to, show this. Florida seems to be the perfect place to see this. Is that you have this, 3 lanes each way, local road with someone crossing with a walker, and it's a nightmare. And then the after picture shows traffic calming, that there's a refugee island for the pedestrians to wait on, that, there's more trees, it's not this barren wasteland, but for bike rack ideas, showing them different pictures of what's out there. I thought I had more. But so, photos place well with local officials, especially the more local you can get, the better. So if you can say, these are the bike racks that neighboring Medford has in front of their high school. Oh, why can't we do that? How much do they cost? You need to know that answer. Then they turn to the DPW head and say, is it possible for us to do that? Yeah, we get the money from DOT, we can do it. And then they say, oh, well, then why aren't we doing this? Second example, smoke-free housing. So in 2004, when workplaces went smoke-free, one weird result is that a non-smoker could go their whole day and not be exposed to smoke on the subway ride, at Starbucks, at their office, when they went out for lunch, on their commute home, until they got in their own house, if they lived in a multi-unit dwelling, and you had neighbors who smoked in their apartments or condos, and the smoke was drifting into your home. Smoke-free housing politically is a tough thing. We couldn't have ever have added it to the state law in 2004 because people you're going to try to tell people what they can't do in their own home. So that was a difficult hurdle to get through. But out of the blue, the U.S. Housing and Urban Development directed public housing to entertain going smoke-free. This is about 8 years ago. It didn't direct them to do so, but it entertained. It made the case that it's better if you could do that. And they were the first ones to put out, from a governmental entity to say, we also have to respect the rights of those non-smokers living in these housing units. Mass Department of Housing and Community Development very reluctantly agreed to this. So we had this funny situation where the federal government was actually, which is usually much slower to do things and much more bureaucratic than a state government. We had the federal government going beyond what our state government was willing to do on smoke-free public housing. So, but what we did is we set out to do a campaign to set up the facts and the policies that a public housing authority could use to go smoke-free, and what they could do to have a successful, not only successfully vote to do so, but then have the implementation go smoothly. So, public housing authorities typically came to us and said, "We're done with the nightmare that is having smoking. We have an elderly smoker who sits next to their oxygen tank and smokes. We had an apartment burned down from someone falling asleep with a cigarette in their Barker lounger. Or it costs $2,000 for us to rip up the carpeting every time a new tenant comes in when the old tenant was a smoker." So we had public housing authorities coming to us, sat down and figured out the local politics. Is this possible? Does the public housing authority have some import in the city or town government? Are they listened to? What would it take to go smoke-free? What are the physical plant costs? What is the physical plan? So a lot of times you had to, first of all, assemble what the public housing authority properties were. Sometimes they wouldn't have a complete list. And you had to know there are 7 properties, these are their addresses, each one has this many units. Sometimes we had to do the work for that city and town to figure that out, but that was our job. That was part of the campaign to do. Figure out really how much does it cost to replace the carpeting? How much does it cost to repaint an apartment where smokers have lived? What does it cost to separate out the ventilation of an apartment that has smoking compared to another one? Can you offer cessation? What are you going to do when you go smoke-free? What do you do with those people who've lived there for decades? And they're heavy smokers. Can you offer cessation? What if they don't want cessation? Where do you tell them to smoke? Outside. Is their balcony okay? Do they have to go out into the parking lot? Will you put in a park bench for them to sit on? And then, typically we'd allow 1 year before the effective date to do this. And we made sure that the effective date wasn't January 1st. We didn't want a front page media article showing some old person outside having a cigarette in a snowstorm and showing how the Public Housing Authority hates old people. Don't do it in the middle of the winter either. And the buildings and our campuses, do you limit it to just the buildings, or did you make the whole campus smoke free? Do you mandate that people go out and stand on the sidewalk? Politics we talked about, media we talked about, enforcement. And what we've learned for this particular thing is to treat the enforcement just like anything else, not to make it special or unique, but to actually just say, this is the same enforcement that a Public Housing Authority person does if a person kept on parking in the wrong parking space, if they kept on playing their stereo at 2 in the morning. So you really just make it part and parcel of the rules that were already in place. School vending machines is my last example. We talked a little earlier. This was an early thing that happened early on for tobacco control, but now we're seeing it for food and drink offerings in cities and towns. So, interesting case came out of the southeast city in the southeast of Massachusetts, where a campaign was to just either get rid of the vending machines or switch them out, and switch out the calorie-dense drinks or bad snacks with better ones. First of all, the city didn't even know where the machines were. When the person found out where they were, there was one in City Hall no one claimed to. Like, Coca-Cola just kept on coming and filling it up, but no one really knew whose machine it was, like who oversaw it, who signed the contract, where was the contract. So some things like that were happening. So it was a campaign to find out where the machines were, are they really needed, was the city willing to just give them up, let them go, and if they didn't let them up, could you switch the offerings? And so it's been funny to watch some of this happen, because it really showed that an outsider was able to really educate people inside City Hall about vending machines.
We did have a question pop up, and a question says, what can a local board of health do about smoking in a privately owned condo that is adjoined and affecting the non-smoking neighbor?
We have in Massachusetts no regulation that has ever mandated a condo to go smoke-free, but condo associations can practically vote on to do anything. They can ban dogs. They can ban, as long as they're not discriminatory, they can ban a lot of things. So we would direct them to go back to the condo association and talk to them, and we would we can arm them with lease language, data on secondhand smoke, infiltration into housing. Large condo associations in Massachusetts that have already gone so, but there's not. That is one area that it's the condo board, not the board of health, that goes into it. Could you argue that a reasonable health regulation would be to ban smoking in condos? You could, but you don't want to get ahead of the community on this and then end up in court. So we do have a couple towns in California that have done this, but again, it just doesn't play that well to say. I can't remember the name of the town, but that town A and town B in California have done this, and they've had problems doing it. So sometimes you might be able to get a very proactive board of health that's interested in this, but we would caution them that you might be getting ahead of yourself here, and that the reason that we were able to work on public housing on this issue was because we had that HUD ruling that recommended housing authorities to do so. When it comes to just regular rentals, we do work with landlords to encourage them to go smoke-free, but again, we have no local measure in Massachusetts mandating that apartment buildings or condos have to be smoke-free. So one thing on the vending machine thing that was interesting is that Boston did this a couple years back, maybe like 5 years back. And so, if you can't get rid of the vending machines, and you couldn't convince the city or Coca-Cola to put in healthier products, that the city came up with, a red-green traffic signal to show that red are bad drinks, yellow are drinks that you can have now and then, and green is good to go, basically water. So this would prove to be a nice, if you couldn't get any policy in place but wanted to do an educational campaign, this was a nice way to go that really didn't have much downside. This is an example of just, this was a press release that it was a little longer than this, but not much. But this is a size that you could hand out to a local official that they'd be willing to at least read the title and maybe the first paragraph. So that we found this to be a helpful thing because it came from the federal government.
All right, so we want to thank everyone for participating in today's online training. We want to let you know that we do have two in-person trainings coming up next month that we hope anyone who's local will join us. And if you want some more information, again, please feel free to visit our website, hrainstitute.org. And please, if you're part of a coalition, please list your coalition on our coalition finder. Again, we want to thank you for participating, and we'll see you at the next training.